Hi, my name is Dr. John Rundback from American Endovascular and Amputation Prevention. We're talking a little bit about peripheral arterial disease, or PAD, and this is a potentially serious condition. Peripheral arterial disease affects up to 20% of Americans over the age of 70, and it involves blockage in the arteries, affecting predominantly the legs, but really anything outside of the heart arteries. It occurs obviously in association with people who have had blockage in the heart arteries, who have had prior strokes, but also patients with diabetes, chronic kidney disease, high blood pressure, elevated cholesterol, family history, and smoking. In many cases, it's relatively benign. You may have blockage in the leg artery, which is asymptomatic, and those patients just need to be encouraged to have lifestyle changes, healthy life choices, not smoke, good diets, and to walk, ambulate as much as they can. However, you need to keep a good close eye on these individuals for two reasons. One is peripheral arterial disease is a marker of subsequent higher risk of heart attacks and strokes. So if somebody has peripheral arterial disease, leg pain when walking, wounds that aren't healing, pain that wakes them at night, you need to make sure that they're on optimal medical therapy, not so much for the legs, but to help prevent heart attacks and strokes. That's potentially dangerous. Secondly, a smaller proportion of these patients may progress on to what we call critical limb ischemia. That is, again, developing a pain that wakes people at night on a regular basis, and there are wounds that don't heal, particularly in diabetics and chronic kidney disease populations and active smokers. And that can be extraordinarily dangerous, and that's why in this country there's a very, very high rate, over 100,000 major amputations a year of lower extremities due to unrecognized peripheral arterial disease. And most alarming, half of those patients with major amputation never get a vascular evaluation prior to that major amputation, which needs to be changed. So potentially dangerous, but with good caretaking and early recognition, we can make a big difference in preventing amputations.